my mask is stuck. Get it? I think it's caught. There we go. Today, we're going to provide an update on the latest analysis of how COVID-19 is spreading in Oregon and discuss an important choice we have to make as a state. 7 months ago today, on January 21st, I established the incident management team to prepare for the possibility of the coronavirus coming to Oregon. This began a coordinated strategy between state and local leaders. 5 weeks later, we had our first case of COVID-19. Since then, unfortunately, more than 24,000 Oregonians have been infected with the virus, and over 400 Oregonians have died. Across our country, more than 5 million Americans have been infected, and over 170,000 people have died. When I issued Oregon's Stay Home, Save Lives order, some folks said it was too rash. Others said it was too late. When I decided to close restaurants and entertainment venues, but keep manufacturing and construction open, some said this action was too much. Others said it was too little. When we began reopening businesses, taking a county-by-county approach, some said it was too cautious, while others thought it was too risky. And today, close to 6 months after our first case, some say my orders are too restrictive, that the virus isn't dangerous, or even that it's a hoax. And then, of course, others say I haven't done enough, that we should shut down the entire economy immediately and start from scratch, regardless of the cost to people's livelihoods. The truth is, those commenting on the far ends of this debate, well, they are missing the point. This has always been a balancing act, a tightrope that stretches and weaves between the two extremes, where for each step I follow the data, where I listen to experts, where I take action carefully and gingerly, not knowing whether the balance will hold. Today, Oregon has one of the lowest COVID-19 mortality rates in the entire country. I want to say thank you to every Oregonian, every business, every local elected official who has helped put us in this position. We have truly slowed the spread of the virus. Wearing masks, limiting social gatherings, enforcing health and safety rules, these strategies work. Unfortunately, it's still not enough. Our infection rate is still too high to get all of our kids safely back into the classrooms and most of our schools this fall. To keep students, teachers, and staff safe in our schools across the state, we need to see a much more rapid decline in case numbers, and we need to see it quickly. There are basically two ways to do this. One option, local community leaders, county officials, and businesses, and all Oregonians can step up their efforts to implement and enforce our existing guidelines, face coverings, physical distancing, sanitation, contact tracing, and compliance with isolation and quarantine. The other option, we can implement further business restrictions and travel restrictions for people entering Oregon or returning from trips outside the state. I believe, and the data indicates, that either one of these strategies will work. Either one will drive down the spread of the virus more quickly. Either one gives us a fighting chance to open up in-person instruction and K through education in much of the state later this fall. But one path has a far greater cost than the other. Closing businesses across the state, like we did with the Stay Home, Save Lives order, works to control the virus. But the economic cost is extraordinary. Behind every business closure are real people who have lost jobs and lost income. families pushed to the brink. Each of these economic costs carries a public health consequence as well. It may come in the form of skipped meals, late bills, added stress, and increased tension at home. And all too often, it may include self-harm, domestic violence, or suicide. Economic costs have real health consequences. That's why I have been so reluctant to order further business shutdowns. We can wrestle this virus to the ground and set an example for the nation. I know that local leaders, businesses, and workers can step up and get the job done. Earlier this week, I challenged local elected officials and business leaders to step up their game. I asked our business leaders to take additional steps to ensure employee and customer safety, to reach 100% implementation of our health and safety protocols, making sure people are wearing masks and staying 6 feet apart. Local officials need to conduct more business inspections in places like indoor entertainment venues and restaurant kitchens. Community leaders need to make sure that as new cases are identified, we are connecting people with economic supports to help them stay home and quarantine, even when they have mild symptoms. We do have resources available so that people can afford to stay home. We need to get that money and help out in the communities where it's needed. Local officials need to get creative about enforcing rules against large social gatherings, big house parties, pool parties, and so forth. Too many cases over this summer have come from these informal social get-togethers. I'm here to deliver a message to local elected officials, local community leaders, and business leaders, and to every single Oregonian. Now is the time to step up even further. Many of you have stepped up and are doing incredible work complying with the guidelines and keeping people safe. Right now, I'm faced with a difficult choice. We have stabilized at roughly 300 cases per day in Oregon. We need to get down to roughly 60 cases per day. And opening classrooms for in-class learning, including childcare and K through 12, is my priority. If we cannot improve our trajectory over the rest of the month by increased compliance with already existing policies and guidelines, unfortunately, I will need to add more restrictions. When it comes to controlling the virus, we have the tools. We need you, we need everyone to use them. Before I wrap up, I want to share a few other brief updates. First, Lincoln County had held back from applying to move to Phase 2 for some time while they addressed an early and large workplace and community outbreak. Their numbers are much improved, and we have notified them that they are likely to be in a position to move to Phase 2 by Labor Day if current trends hold. Second, 3 weeks ago, we moved Morrow County back to Phase 1 and moved Umatilla County back to baseline stay-at-home status. After a solid decline in case counts, today Umatilla County will move to Phase 1. Morrow County, Malheur County will remain in Phase 1 as well. Finally, yesterday, we announced that we're taking Marion County and Wasco County off the county watch list now that they have addressed the high rates of unexplained community spread in their communities. Local public health officials and their state counterparts worked hard to get this under control. They were successful. Unfortunately, we've now added Jackson County to the county watch list because they have seen an increase in unexplained community spread of the virus. State officials will work with local public health leaders to help the community get this under control. I know how much each and every Oregonian has sacrificed over the past 6 months to protect your families, your neighbors, your communities. Many of you struggled to pay your rent or had to lay off your employees. Many of you couldn't visit loved ones or give Grandma that extra bear hug she deserves so much. Many of you put in extra shifts to serve your communities as frontline workers. Many of you might miss the fall sports season or missed summer sports. And many parents across the state have been balancing work and childcare. Thank you. Thank you. Thank you. We all want in-person education to reopen. To do that, we must meet our goals. Right now, on the course we're on, it's going to take too long. We're doing well, but we have to do better. We have to work together, and we have to do it now. Thank you. Now I'm going to turn it over to the Oregon Health Authority Director, Pat Allen.
Thank you, Governor. Again, I'm Patrick Allen, Director of the Oregon Health Authority. I'd like to provide a brief overview of where we are in the pandemic and our response to it before I turn things over to Dr. Dean Seidlinger, who will update you on our latest modeling, our current estimated infection rate, and where we need to be able to open schools. Here are the latest numbers. Excuse me. To date, we've recorded 24,421 confirmed and presumed cases of COVID-19, including 259 today. Sadly, we've crossed the threshold of over 400,000 deaths this week, including 2 today, bringing us to a statewide total of 414. These are over 400 people who have left behind families, friends, colleagues, and neighbors who will miss them, and we extend our deepest sympathies. New cases are starting to slowly decline. That's a hopeful sign that Oregonians' efforts to wear face coverings in public places, keep physically distant, and limit social gatherings are slowing the spread of COVID-19. For the second consecutive week, daily cases have declined. For the week of Monday, August 10th through August 16th, OHA reported 1,963 cases. That's a 7% drop in new infections from the previous week. There were fewer deaths reported than the previous week as well, dropping from 39 to 31. The percentage of positive tests has leveled off. Last week, we reported 25,678 test results, and the rate of positive tests stayed the same at 5.4%. Please note that that's a data point that will change over time, as we're now counting tests by the date the specimen was collected, meaning that those numbers will change a little bit as more test results are reported to us. Hospitalizations offer another encouraging sign. New COVID-19 hospitalizations also declined last week from 143 to 115. The downward week-to-week trend in COVID-19 cases is in line with our modeling, which was updated today. Dr. Seidlinger will speak more about that shortly. We're making a difference in stemming the tide of COVID-19 in our communities, but the virus remains prevalent across the state of Oregon, and it's a risk to everyone. We're on the right track. Now we need to step on the gas. I want to share one more encouraging development on COVID-19 testing. This week, we secured an agreement between the Oregon State Public Health Laboratory and Thermo Fisher that will provide testing supplies to add over 20,000 tests to our weekly capacity on average through December, or about 400,000 tests in all. The tests will be distributed to certain qualifying laboratories, increasing Oregon's overall COVID-19 testing capacity. The new agreement builds on one that the state lab had in place with Thermo Fisher and the U.S. Department of Health and Human Services in May and June, under which the state lab received and distributed supplies for some 130,000 tests. The State Public Health Lab will continue to distribute test kits to its current partner laboratories and will reach out to additional qualified labs to further expand testing capacity in Oregon. Adequate testing is important to slowing the spread of COVID-19. If we cannot test people and get the results back quickly, we lose our ability to take steps to keep the virus at bay. This agreement will help speed up results and ensure we have more capacity to test as needed. With that, let me turn things over to Dr. Dean Seidlinger, our State Health Officer, to discuss the latest modeling data.
Thank you, Director Allen. I'm Dean Seidlinger, the state epidemiologist here in Oregon. You've heard an overview about the present state of the virus in Oregon, and I want to update you on what we can expect over the coming weeks. Our latest report shows that the transmission of COVID-19 is slowing and that we're seeing this declining transmission, which started at the beginning of July. The new report, again, models 3 scenarios, and all 3 suggest that the actions we're taking are working to flatten the curve. If our transmission continues at its current rate, our estimated number of weekly infections will remain steady at approximately 900 over the next 4 weeks. Severe infections, meaning people that need to be hospitalized, would remain stable at about 19 per day. That represents a transmission rate of 1, meaning for every person who's sick, they infect 1 other person. If we can get this transmission down by 10% over the next 4 weeks, we can expect the number of COVID-19 infections to drop. Compared to the previous scenario, we would see 600 fewer infections each day and 8 fewer severe cases. That gets our transmission rate down to 0.75, meaning each person who's sick infects less than 1 other person. But if transmission increases in the next 4 weeks, we would see 1,300 new infections daily, an uptick in severe cases to almost 30, and that transmission rate of 1.25 represents a significant step back. And I don't think we're going in that direction, but we all have a role to prevent that from happening. So while our COVID-19 data shows that we're doing better than many other states, the virus continues to be a significant threat in our communities, and we're not close to keeping the infection rate at a level we need to reopen schools across Oregon. We've made progress. The model shows that our collective actions have reduced transmission rates since the increases we saw after we reopened. And we see that confirmed by the leveling off of numbers that Director Allen presented to you. Oregonians have flattened the curve again. But as the charts behind us show, we're still months away from driving infection rates down to a level which we could safely reopen schools. We need to cut our transmission down from 1 to 0.75. Currently, we estimate that every person who contracts COVID-19 is passing it on to 1 other person, and we need that to decrease. To safely reopen schools, we need to make sure that people who become infected are passing it along to fewer numbers of people so the virus is not spreading at a sustainable rate. I want to tell you a couple of stories about what we're seeing in the data here in Oregon. When we talk about workplace outbreaks or outbreaks in a skilled nursing facility, most people probably understand what that means. But when we talk about social spread, people may have a harder idea. So I want to share a couple of things that our epidemiologists and our local public health authorities are seeing.